Hi, my name is Nicole Bonnekamp and I work with McCunis Fox Health Insurance Brokers. The purpose of this video is to spend a little bit of time on Medicare Basics. If you're currently on Medicare and you're confused about the commercials that you're seeing and the mailings that you're receiving, or if you're getting ready to be eligible for Medicare, this video is for you. Medicare, original or traditional Medicare, consists of two parts. Medicare Part A covers your hospitals and your skilled nursing facilities. Medicare Part B covers your doctor's office and outpatient services. Medicare Part A, there is typically no monthly premium for because that's what you worked all of your years for and became entitled to. Medicare Part B, there is a monthly premium, and that premium is standardized by Medicare, and it can be higher if you have what Medicare considers to be a higher income. Again, Medicare Part A and Part B combined is what's known as original or traditional Medicare. On traditional Medicare, there are deductibles and co-insurances that you are responsible for. A lot of people think of Medicare as an 80-20. Medicare pays 80%, I pay 20%, and that's an okay way to think of it. But what most people don't realize is that the 20% on Medicare keeps accruing and accruing and accruing. There's no maximum to what you could owe. So my example of that is our agency has a client out in Beaumont, and when she first turned 65, she was on just Medicare by itself. She ended up going into the hospital due to a serious heart condition for about 90 days. Her total bills were about $400,000, and once all was said and done, she was responsible for $30,000 of that on Medicare. So we need something in addition to Medicare to protect us from that 20%. And there's only two ways to do that. The first way is what's known as a Medicare Supplement plan, also known as Medigap plans. And Medicare Supplement plans kind of act as like a secondary to your Medicare. So Medicare would pay its portion of the bills, your supplement plan would then pay its portion of the bills. You do pay a monthly premium for your supplement plan, and that monthly premium is in addition to the Medicare Part B premium that you're going to be paying Medicare directly. But what's nice about a supplement plan is that you typically have very little out-of-pocket costs on a supplement plan when you're having services rendered. So when you go to the hospital or when you go to the emergency room, the doctor's office, things like that. Now, supplement plans are nice because you can go to any doctor or facility that accepts Medicare, and that's anywhere in the country. So you do have flexibility and freedom and choice of doctor on a supplement plan. Now, Medicare and supplement plans do not cover prescription drugs, so you would need to purchase a separate standalone prescription drug plan. You would pay a monthly premium for that drug plan, and you may have a deductible that you would need to pay, and then you'll pay co-payments for prescriptions as you get them filled. The second way to protect yourself further than Medicare is called a Medicare Advantage plan, also known as Medicare Part C. And these plans are run by private health insurance companies. They combine your Medicare benefits into one plan. So all of the benefits that you're entitled to under Medicare Part A and Part B, you still get all of those on a Medicare Advantage plan. Plus, Medicare Advantage plans typically will offer you prescription drug coverage, and they have what we call the additional benefits. They have generally some dental, vision, over-the-counter items, hearing benefits, transportation, gym memberships, and things like that. They take all of those benefits and wrap it up into one plan. Now, these plans are typically offered to you at a low or no monthly plan premium, but you do still have to continue to pay your Medicare Part B premium that you're paying to Medicare directly. Medicare Advantage plans are also typically network-based. They're usually HMOs and PPOs, and I'm going to have a follow-up video where I go into more of the details about the differences between HMOs and PPOs. Now, a lot of my clients will ask me, Nicole, what's the best? Do I need a Medicare Advantage plan or do I need a Medicare Supplement plan? Which one is the best? And truthfully, there is no best. They all have their pros and their cons. My job is to help narrow down those options for you. I do what we call a thorough needs analysis, where we'll talk about any preferences that you have, the doctors that you see, any prescriptions that you take, and I can make an unbiased recommendation based on your specific circumstances. I am a broker. I represent the vast majority of the companies that are available to you, so I can offer you an unbiased recommendation. If you have any questions, please reach out to me directly. I look forward to helping you with your Medicare options.